Jalaa Abdelwahab is a health specialist and a technical officer at the UNICEF's polio eradication team. He joins me now live from Geneva. Good to talk to you, sir. I've got to ask you, here is the security question that really has to be confronted. These threats against health workers in Pakistan are not new. So the question is, why hasn't more been done to protect your workers?
Basically, just to start by explaining that from our side, from UNICEF and the other larger partnership, including WHO, our role is mainly supporting the government. The implementing part of the initiative is actually the government of Pakistan, who deploys people into the field and actually oversees the entire campaign. So from our side, we rely on the government to institute the security measures that are necessary to secure the safety of all health workers.
So can I stop you there? If your name is attached to it, don't you bear some responsibility to protect the people who are working under your tent, under your umbrella?
From our side, like I have said, basically we follow under the umbrella of the overall security of the government. But from our side, we also follow the UNDSS security measures. And so currently we're also reviewing these measures in light of the situation and revising them to make sure that we secure the safety of our staff that are on the ground. So this is not something new. This is continuously done as the situation changes on the ground. And as you know, this is a very fragile situation. So we're very adaptable in terms of changing the security measures as the situation changes.
So here's something that seems to me has to be a part of the rethink. These huge 3-day drives, thousands hired to health workers in these countries. You can't possibly protect everyone. Isn't there a better way to do this?
You know, it's important that what you've mentioned, these are actually the frontline workers for delivering basic health interventions in Pakistan. So it's actually beyond the 3-day drive. These are the same people who deliver multiple vaccinations and other health interventions to these same communities. They're the ones who are actually going houses to houses, going to the health centers every day in probably the hardest to reach areas. So from our side, this is actually, the attack is primarily on the health institutions of the government, and our shock and actually about the situation is how do we mitigate this measure, and we're waiting to hear from the government, who's conducting an overall assessment and investigation of the situation to better understand the root causes of what has just happened. Because I think what have just happened in the past few months is something new.
So here's the problem you have now. 9 of the health workers are dead, which means you probably intimidate thousands of other health workers. I think you would grant me that. Given the events of the last 3 days, do you worry that this program will essentially grind to a halt?
Basically, from our side, we remain committed to the decision of the government. The government is the one who makes the decision, not us. The government will make the decision when the campaign starts, when the drive continues. But my understanding is that all the partners, which at the spearheading of them is obviously the government, is committed to finishing the job. So we rely on the government to give us the direction of when they want to continue and how they want to continue. They're the ones who will give us the direction if there need to be modification in the strategy to secure the safety of these health workers, which are the heart of this issue, actually.
But you won't recommend that your people go into situations where you don't trust that the proper measures have been taken to secure them, correct?
Our people, what we're talking about is the health workers who are actually the government of Pakistan and the people of Pakistan. So from our side, as UNICEF, we provide technical assistance, we provide the vaccine, and we provide some monitoring support. But the decision on how to implement the campaign and how to proceed is actually based on the government. So we fully support the government in their decision to do that.
I see. Okay, I understand fully now. Jalaa, I appreciate your time. Jalaa Abdelwahab is a health specialist and a technical officer at the UNICEF's polio eradication team, joining us from Geneva. Thank you, sir.